TV's W5. A dangerous epidemic hiding in Canada's hospitals.
People know this is happening.
Missing medications and stolen drugs.
Be a pill, take a pill.
Who's using the medicine you were prescribed?
I think there's a significant problem.
Avery Haines investigates drug abuse among healthcare workers.
Which means you're working high.
Yes, I'm working high.
The easy access.
And just like that, they're going to switch it out.
And the widespread effects.
2 or 3 of them are going to be under the influence.
That could threaten helpless patients.
If it happened to me, I know it's happened to other people.
And a loving hockey mom.
I could always hardly wait to see him get out on his shift.
Who vanished in a moment of heartbreak.
I knew things are serious.
And a rising hockey star's determination.
There's a guy that persevered.
That helped bring her back.
Oh, you never give up hope. Never.
And
Explorer 1 was a very small satellite. It was only about as tall as a person.
the race to the final frontier.
America had to respond to the Soviet successes. This was a major issue.
Begins 6 decades of exploration.
Everybody who wasn't paying attention to space before now to suddenly pay attention.
And reminds us of how far we've come.
It had an enormous impact.
Here is Kevin Newman.
Hello, and thanks for joining us. It's the dirty secret inside hospitals and healthcare facilities. Medical staff who are addicted to narcotics. They're stealing them from locked cabinets and even from patients who need the pain relief. Now, some hospitals have quietly brought in programs to help doctors. But as W5's Avery Haines uncovers, there are very few programs for nurses who need help to kick their addictions.
Colorado mother Lauren Lolini had no idea when she went into the hospital in 2009 for a simple surgery that her life would be forever changed.
Everything with that procedure went well, and then about 6 weeks after that, I started to feel fatigue, extreme fatigue, and it just seemed a lot more intense than it should be.
An emergency room doctor gave a shocking diagnosis. Lauren may have gone into Denver's Rose Medical Center for a kidney stone operation. She came out with a blood-borne disease, hepatitis C.
It hit me like a ton of bricks. Like, I had no idea the severity of hepatitis C, but I knew it was bad.
Lauren immediately began treatment and tried to solve the mystery of just how she could possibly have become infected. She finally learned through a doctor that it had happened while she was laying on the operating room table.
And at that point, that's when I called the health department back again and just said, if it happened to me, I know it's happened to other people. I know it has to. Please, please investigate.
Lauren was told alarming news. On the day of her operation, a surgical assistant who was addicted to opioids injected the fentanyl that was meant for Lauren into her own arm and refilled that same syringe with saline. The medical tech stole Lauren's pain medication and at the same time infected her with a potentially deadly liver disease.
So I didn't get the fentanyl that I needed, but I also got her hepatitis C.
A healthcare worker named Kristen Parker had been stealing narcotics from patients for months. She had infected 36 people with hepatitis C. Another 6,000 patients who may have come into contact with her had to be tested for the disease.
When hospital workers steal drugs to feed their habit, it's called drug diversion. Nurses are no more likely to divert than doctors or pharmacists or paramedics, but the national addiction rate is 20%. There are 415,000 Canadian nurses. That means at any given time, some 83,000 nurses are struggling with addiction, all the while working in an environment with surprisingly easy access to drugs. Drug diversion has been described as a silent epidemic, and yet few Canadian hospitals will even acknowledge that it's a problem.
I think it's probably a problem in probably virtually every country. If you have access and you have human beings that potentially have addiction issues, you're going to have this issue.
John Berkey is one of the leading anti-diversion advocates in the United States. He's also a former cop. John created the International Health Facility Diversion Association to combat this growing problem.
Institutions don't report, I think, for a variety of reasons. You know, they are concerned about being on the 6 o'clock news and showing that, hey, a nurse stole drugs out of this and they were arrested.
The problem is so big that this convention in St. Louis, Missouri drew hundreds of people from across the U.S. and Canada, all trying to detect and stop drug diversion. Berkey has plans to hold a Canada-specific conference in 2018.
I think one thing that we realize, and of course there has been some issues in Canada involving this, and we're hoping to expand that too into having our Canadian neighbors so that we can share information more.
Unlike in Canada, many police forces in the U.S. have units dedicated to investigating hospital drug diversion. John's police department in Cincinnati, which is about the same size as Saskatoon, was averaging about 1 nurse arrest every week.
And when you look back at what we did in Cincinnati, and it wasn't anything that Cincinnati was a hub for this, it would come down to 102 nurse arrests a day if you extrapolated those numbers out across the United States.
Diversion victim Lauren Lalini works with John's organization to raise the alarm about just how common diversion is.
What stuck in my mind, like, wow, like people know this is happening. Like this isn't something that just happened to us. I mean, it's happening other places too. And you know, for this particular person who had a addiction issue, it was kind of like being a kid in a candy store.
Canadian nurse Julie has been that kid in that candy store.
It was like a reaction, see a pill, take a pill. I had no idea where it would take me, but it was the start of a very devastating course of drug addiction.
We're concealing Julie's identity because what she has to say about addiction and hospital drug theft could threaten her nursing career. Julie still works as a nurse in Canada. She provides a rare insight into just what addiction can look like inside a hospital.
Can you take me back to that day or night you're standing at the hospital? You're going in to see a patient who needs pain medication.
This particular gentleman always took pain medication at night, so I had gotten it ready, was ready to give it to him, and he didn't want it. So I just popped it in my mouth, and it gave me the euphoria that I was looking for. It gave me the high that I felt I needed to get me through my shift.
Julie's use increased day by day. Within months, she was injecting opioids multiple times per shift.
Maybe 5 times in a shift.
So you go into the bathroom and inject?
Yeah.
Which means you're working high.
Yes, I'm working high. I mean, I felt at the time that I was working better. You know, it sounds crazy to me now, but that made me feel invincible.
Did you ever take pain medication that was destined for a patient who was in pain, who didn't get it because you took it?
Eventually, I ended up doctoring the medication sheets to make it look like I had given patients things in the middle of the night and I would have taken it.
And Julie is not alone. Experts say drug diversion is vastly underreported. While the bodies that license nurses expect hospitals to report to them, there's little oversight to make sure they do. W5 found dozens of cases right across the country, and all were dealt with in very different ways. A nurse in Kingston, Ontario, was sentenced to 2 years in prison for diverting drugs from hospice patients, while a Quebec nurse was suspended for 15 months. Another nurse in British Columbia was fired and lost her provincial license. In several cases, W5 found nurses were reinstated. Julie hid her addiction while stealing pain meds meant for her patients. Eventually, she got sloppy, and the hospital caught her. She went into rehab on her own and returned to work. And then one day, Julie became one of the statistics we have heard so much about. She relapsed and overdosed on fentanyl patches that she secretly had taken home from the hospital garbage.
But I had no idea the power that was still in those fentanyl patches when I used them. And so I had quite a few of them on at a time. As soon as I sort of felt like the high was going, I'd put another one on. And one morning, I just didn't wake up.
You were taken to your hospital?
I was taken to my hospital emergency department, yes.
And so what's that like to go in
So I woke up in the emergency department, obviously terribly embarrassed, terribly ashamed of where I was.
Tempted by easy access.
And then just in a matter of literally seconds, and they're out the door.
And the desperate measures taken to get a fix.
You were doing your job impaired?
When W5 continues.
When hospital staff with addictions steal drugs from work, it has a name: drug diversion. And it can have catastrophic outcomes for both the addict and patients. According to Statistics Canada, the addiction rate in the general population is 20%, and that 20% includes the staff at hospitals and pharmacies.
There's no bias when we're looking at the addiction and substance abuse. There's no bias.
Nurse anesthetist Rigo Garcia knows all too well the danger of unlimited access to narcotics. He's spoken to the U.S. Congress about diversion and runs a rehab center for healthcare workers in Indiana.
If you come into the hospital, you're typically going to run into 20 or 30 different people, different specialties from nursing to medicine to pharmacy. Out of those 20 or 30 people, 2 or 3 of them are going to be diagnosable as a substance use disorder. So this here is the pre-op holding area. This is the first encounter that I usually have with the patients and their families.
Rigo took W5 inside an operating room to show us just how easy it can be for addicted staff to take drugs meant for patients.
So you can really find diversion potential and diversion opportunity in most ORs, most ERs, most hospitals.
So this is laid out well before an operation actually gets played
Correct.
out?
Someone who's trying to divert the medication is going to have a syringe pre-filled with medication, and they'll come in a matter of 2 seconds, they're going to walk out the door. So it happens that quick. A little bit of diversion, hey, look over there, or can you get this for me? And just like that, they're going to switch it out.
It took seconds for you to take a potentially deadly dose of
Absolutely.
fentanyl.
And then just in a matter of seconds, a nurse from the floor, a scrub tech from the floor, our stickers are right out here. They pull up a syringe, and then just in a matter of literally seconds, and they're out the door, and nobody knows anything.
Rigo knows what he's talking about. 8 years ago, a broken ankle and a legitimate prescription for the opioid Vicodin set him on a collision course with addiction.
It's difficult for me to describe to you how desperate it feels at that moment, knowing that the answer is another pill, but you don't have it.
And so you look around your place of work, which is a hospital, which is surrounded with all of the answers to what you're going through.
Absolutely.
Soon, Rigo was getting high every day, off opioids left over from patients.
We draw these imaginary lines in the sand, and you say, I would never do this. You know, I'm taking this medication now, but I would never take it for my patients. And then if you cross that line, I would never do IV. There's always I would never do this. But over the course of time, you erase that line and draw another line and move it down the road a little bit.
And is that hard to reconcile in your head that you were doing your job impaired?
Absolutely.
Rigo kept his addiction secret for months. He was caught when administrators noticed he was signing out far more medication than anyone else.
So the feeling that I had at that moment was a sense of relief.
Unlike in Canada, diversion is a federal crime in the U.S., and hospitals must report addicted nurses to their licensing body and police. Most are put into rehab programs, but some are arrested. After completing his state-mandated rehab, amazingly, Rigo resumed working as a nurse anesthetist, providing for patients the very drugs that nearly cost him his life.
When you first came back into an operating room, sober now, what thoughts went through your mind?
I would be lying if I didn't say I wasn't a little bit nervous. I set up my room and I pulled out my medications, and I grabbed the same medications that caused all this havoc in my life and all this turmoil in my life, and I put them in my hand and I looked at them and overflooded with emotions.
By contrast, the hospital that caught Canadian nurse Julie never informed her nursing body about her addiction, so her treatment was voluntary.
I basically admitted to them that, yes, I was using narcotics from work, that I was going to go into a treatment program again, and I was just waiting for them to call the College of Nurses, basically, and they never did.
Even after a near-fatal relapse, Julie's hospital did not report her or mandate treatment. Rock bottom, Julie checks herself into a long-term rehab facility. She eventually went back to work at her hospital with conditions: no access to drugs, random testing, and a warning that if she relapsed again, she'd be fired. Julie still attends an addiction support group for medical professionals.
I'm guessing probably 75% of the nurses in that group have misappropriated medications, stolen medications from their place of work for their addiction.
Do you think that police should have been called? You were stealing drugs from your employer.
I understand why people think the police should be called, because what I did was illegal. What I did was harmful to my patients, unprofessional. I'm grateful the police weren't called, because that's not something that I would want to have to go through.
Julie has met several nurses whose hospitals did call the police, a sign that there's no standard way of handling addiction and theft cases in Canada.
So why the difference? Well, there are no federal guidelines that dictate just how hospitals should handle drug diverters. Nothing that lays out who should be informed or what should happen to those who are caught. The result is a patchwork system that sees some nurses in rehab, others having their licenses stripped, and still others ending up in jail.
It's clear that hospitals don't always report nurses who divert. There are 175,000 nurses in Ontario, and yet W5 has learned that Ontario's College of Nurses received only 70 reports of potential diversion in 2016. Out of British Columbia's 40,000 nurses, only 20 reports of theft were under investigation at its College of Nurses in 2017. Despite their easy access to addictive drugs, nurses in Canada do not have a cohesive national program to get help. Doctors do. It's called the Physician Health Program.
Doctors have the opportunity of connecting with the Physician Health Program in order to get help.
Dr. Gary Veenman is an addiction specialist at one of Canada's leading treatment centres, Homewood Health in Guelph, Ontario.
And you know that that program is not there for nurses who have better access to the very drugs that they need in their addiction. This must be incredibly frustrating for you.
It is frustrating. The challenges with nurses and with any health professional that's addicted is the shame that comes with the disease of addiction. Nurses, are they more prone than physicians? No, I wouldn't think so. Just stemming from the percentages that come in and the percentages that there are more nurses than there are doctors.
We contacted Canada's 10 largest hospitals regarding their diversion rates and policies for all staff. Many told us that it's discretionary whether police or a licensing college would be informed. Some of their responses: Toronto's Sunnybrook Health Sciences Centre. We don't have a specific policy on drug diversion. We do have procedures in place to address theft. Calgary's Foothills Medical Centre. Responses are determined on a case-by-case basis. London Health Sciences Centre, these cases are rare.
I think there's a significant problem of nurses having access to the opioids. I think every hospital should be watchful and monitor that.
But the regulatory bodies and the nurses associations are telling us there's not a problem here.
There is a problem all over Ontario.
And Canada.
And Canada.
And in the hospital.
And in the hospitals. We get a significant amount of our patient load out of British Columbia, and some from the Maritimes, and some from Manitoba.
Health Canada does not keep track of healthcare workers who steal drugs. Instead, it logs how many times narcotics themselves are stolen, tracking individual pills and vials. Hospitals are supposed to report that information to Health Canada, but there is no guarantee they will. A W5 Access to Information request reveals only 487 reported incidents of loss or theft of hospital drugs in 2016. With more than 1,500 hospitals in Canada, that would mean if each of these reports came from a different hospital, fewer than a third reported even a single pill or vial going missing in an entire year. A case like Julie's, which her hospital did not report to anyone, wouldn't be reflected in these statistics. For months, we've been trying to set up an interview with Health Minister Jeanette Petitpas-Taylor to talk about this problem and what her ministry plans to do about it. In the end, she would only give us a few minutes after question period. Diversion experts, addictions experts are saying that this is a silent epidemic, the stealing of drugs by nurses. And I'm asking you as the health minister whether you need to put this on your radar.
It's absolutely a situation that we will continue to work with our provincial colleagues. We have to work collaboratively in order to effectively address the opioid situation that's happening on the ground.
Should there be federal guidelines, though, that track just what should happen to nurses when they're caught? It's a big patchwork that doesn't seem to be talking to each other.
With respect to different professions, again, we have to recognize that different professions are regulated by different bodies, let it be the Nursing Association or the Doctors Association, the College of Physicians and Surgeons. So we really have to make sure that we continue having this conversation, but we also have to work collaboratively. There's no silver bullet solution when it comes to this situation that's happening on the ground, and I've learned that very quickly.
The minister might not have been willing to get specific with solutions, but addiction specialist Dr. Gary Veeman has one idea: a national addictions program for nurses.
I would think that it would benefit the nurses in terms of standardization and accountability. And I think in that respect, the relapse rate would even be lower amongst the nurses than it is right now.
Could save lives.
Could save lives, yes. Would be very, very helpful to my way of thinking.
Julie, who relapsed several times before entering long-term rehab, was never reported to her college or to police. She thinks that it may have helped if the hospital had been forced to do so.
Looking back on that now, do you wish that they had done what they were supposed to do, which is contact the College of Nurses?
I have some mixed feelings about that. Certainly the College of Nurses can be quite punitive. However, if I was more closely monitored, it might have spared me, my last 2 relapses.
In the U.S., the healthcare worker who infected Lauren Lalini and 35 other people was reported to police. Kristen Parker is now serving a 30-year prison term. The only reason Lauren knows that she was a victim of drug diversion is because she was left with the potentially deadly proof, hepatitis C. She's sounding the alarm for other patients who may have no idea that their hospital pain meds are being used to fuel the addictions of workers in crisis.
I think drug diversion is one of those things that not a lot of people talk about unless people are harmed. And that's too bad, because I think people are being harmed every day.
Well, nurses and doctors aren't the only healthcare professionals affected by drug diversion. During our investigation, W5 was told of multiple cases of paramedics and healthcare aides who are also addicted at work. Here's what's straight ahead.
A mother's pride in a son's stellar career. Forgotten in an instant.
I can't remember anything.
When W5 continues.